Are you looking for the best stretch for tennis elbow? If you have tennis elbow or a pain on the outside of your elbow that you think is tennis elbow or that your doctor has told you is tennis elbow, then this video is for you. Hi, I'm Dr. Dave Candy, and in this video I'm going to tell you about the two different types of tennis elbow. And I'm not talking about golfer's elbow, the two different types of tennis elbow on the outside of your elbow, which stretch is best for each, and what other things mimic tennis elbow and how you can take care of them so that you can get back to doing the things you want, even if you don't play tennis. Now, if you find this video helpful, give it a like or thumbs up and subscribe to our channel so you can get notified of our future videos. So first of all, what are the two different types of tennis elbow? Most people actually haven't heard of this. Most people who have looked into tennis elbow for any reasonable amount of time have found out that there's tennis elbow and then essentially the same thing on the inside of the elbow called golfer's elbow. But I'm actually talking about two different types of tennis elbow or lateral epicondyle algia on the outside of the elbow. Just to break down that medical term, the epicondyle is the bump on the outside and the inside of the elbow. Lateral epicondyle means the bump on the outside of the elbow, and algia means pain on the outside part of the elbow. So lateral epicondyle algia means pain on the outside of the elbow. Now, you may have heard tennis elbow referred to as lateral epicondylitis, and that's one type of tennis elbow where there's actually inflammation or itis on the outside of the elbow. But there's another non-inflammatory type of tennis elbow, which is actually more common, and especially in people who don't play tennis or golf or some other sport where you do a lot of quick movements with your arm where you're twisting the arm. So here's what the lateral epicondylitis, the traditional term for tennis elbow, means. When you're playing tennis or when you're playing golf, you're doing a motion with your arm. If you're hitting a lot of top spin on a forehand where you're twisting like that, that's called pronation of your arm. And when your arm is twisting like that at a high speed, it puts a lot of pressure on the tendon where it attaches to the outside of the elbow. And largely, that muscle is trying to slow your hand down at the same time as it's stretching. So it's trying to contract and stretch at the same time. And what that ends up doing is it causes micro tears in the tendon and in the part of the sheath around the bone, the periosteum, where the tendon attaches to the bone. And that can cause some inflammation. Now, a traditional treatment for tennis elbow is a cortisone injection in the elbow, and those work sometimes. Usually those will work for a short period of time for the itis type of problem where there's inflammation on the outside part of the elbow because cortisone is an anti-inflammatory. But you still want to fix the actual problem. Now, what's the best stretch for the lateral epicondylitis, the inflammatory problem on the outside of the elbow? Well, if this type of motion, when you hit top spin on a forehand or top spin on a serve, or with your other arm as you're following through on a golf swing and it's coming through like that, you can develop tennis elbow in golfers on their trail arm. So what's the best stretch for that type of problem? Well, if you've Googled or looked on YouTube for tennis elbow stretches, you've probably seen this thing right here where you hold your hand out like that and stretch down that way. And it stretches those muscles that go on the top of the forearm and attach to the outside of the elbow. Now, the problem with that is if your mechanism of injury, the way you hurt your elbow, is doing that same motion, doing more of it probably isn't the best thing to help get it to feel better. And it may actually slow down your progress. So if you have an overstretched, sore tendon attaching to your elbow that's inflamed and you do more of that, it's probably going to make it worse. Now, on the contrary, the muscles on the other side of the forearm, here where it's not sore, those are the muscles that you do to do that sort of whipping motion of your forearm where you twist it inwards. And those get quite tight if you play tennis, if you're gripping the racket hard and twisting like that. So stretching those muscles is actually a good idea. And the way you do that is with your palm up, kind of pulling down this way. So you stretch the muscles on the opposite side of the forearm that are pulling and tugging and causing that tendon that attaches to the outside of the elbow to get overstretched and sore. Now, there's also a biomechanical problem with that as well. You need to focus on your tennis swing because if you're doing all of your motion with your forearm, then you're putting way too much stress on that tendon. You really should be following through your shots with your body, not just doing it with your forearm. So if you need some more help to improve your technique with your tennis or pickleball swing or your golf swing so that you don't cause so much stress on the outside of your elbow, then we'd be happy to help you out with that. Just give us a call or contact us through our website and we'd be happy to help you out. Now the second type of tennis elbow, the non-inflammatory type of tennis elbow, that comes from more low load activities over a long period of time. Think about like office workers or factory workers, people who are doing repetitive activities with their hands over and over and over. It's not particularly exertional. You just do it thousands of times per day, day after day after day, week after week after week, month after month after month, potentially for years. And over time, that chronic exertion on the muscle belly can start to develop trigger points within the muscle. Now, the trigger points in your forearm muscles, the muscles that extend your wrist, such as when you're typing, or if you're a concert pianist or someone who plays piano a lot, the muscles that do that, violinists, doing all that finger motion with your arms, that can cause a low load muscle problem in your forearm. And that's actually non-inflammatory. If you do an ultrasound of the elbow or an MRI of the elbow, you probably won't see inflammation there. But what happens when you're contracting those muscles under low loads is you develop sort of knots in the muscles that are called trigger points. Now, if you look under a microscope at those trigger points, or rather on a high definition ultrasound or an MRI, you can actually see that when those muscle fibers start to get tight, they constrict the blood flow, the small vessels, the capillaries that provide nutrition to the area, and you actually start to lose oxygen, the oxygen that comes in the blood flow to the muscle. Now, you use oxygen to produce energy, and you need energy actually to get a muscle to relax. It sounds really weird, but it actually takes energy to relax a muscle. And if you don't have that energy because of those trigger points, those knots that have built up in the forearm, then you can start to get what's called a referred pain. That is actually, the source of it is in the muscle belly, but where you may feel it is in the tendon. It also impairs nutrition to the tendon because tendons don't have a good blood supply as it is. And if you're impairing the blood flow to the tendon, then your tendon is not going to heal as quickly. And you can develop what's called a tendinopathy. Different from a tendinitis where there's inflammation. In a tendinopathy, there's a tendon problem where the fibers are not straight like that anymore. They're kind of disorganized, but there's no inflammation. There's no inflammatory markers when you actually look at it. So how do you treat a tendinopathy type of problem? Well, largely there's two things you need. You need to take care of the trigger point problem, the thing that has restricted blood flow in the first place. And for that type of problem, this stretch like this is actually a pretty decent stretch. Now, you don't want to stretch it as far as you possibly can. You don't want to stretch into pain. You should just feel a stretch across the top part of the forearm. If it's causing you pain, you're really cranking on it and getting it all the way up there in the elbow, probably back off a little bit. You just need a gentle little stretch to help get you moving in the forearm a little bit better. Your wrist, the wrist joint, if there are joint dysfunctions or bones in the wrist that aren't moving as well, that can also cause some issues, particularly in office workers or people who play music or do repetitive activities with their hands. And so getting your wrist addressed is also something that you want to look into. Now, the other thing is the oxygen, the blood flow problem. And if you think about doing aerobic activity like running or biking or walking, those are all aerobic type of activities where you're getting a lot of oxygen. But you want to get aerobic type of activity in your arms. So things like just doing simple wrist extension activities where you're just using a low load on that muscle and doing it over and over and over and then resting. And allowing some time to get the oxygen back before you go back to overworking the muscle. Because again, doing this all day long chronically without rest is what caused the problem. So you want to get the muscle reconditioned, but you want to do it in a way that allows some rest. So low load repetitions, where you're doing high repetitions, we're talking on the order of 100 to 200 repetitions. Going up and down like that with your wrist, maybe in sets of 10 or 20, and then rest. Probably a good 30 seconds to a minute between sets. So this can take you a little while to get that muscle reconditioned. But if you're getting in the 100 to 200 repetitions per day range, you're probably on the right track. So that's for the two types of tennis elbow. The inflammatory type of tennis elbow, the tendinitis, where you don't want to stretch down like that. Instead, you want to stretch like this. and then the non-inflammatory tendonitis, where it's actually kind of okay to stretch like that. And then you also want to build back up the oxygen carrying capacity of the cells within the muscle so you don't have that lack of oxygen within the muscle and within the tendon. So what are the other things that can kind of mask a tennis elbow? Now, a lot of times tennis elbow problems can be either fully caused by your neck or your shoulder where there are pinched nerves, or more commonly, there's a little component of that and it's making the actual local problem worse. So in most cases, there is actually a local problem in your elbow, but pinched nerves in the neck or in the thoracic outlet in this area right here can cause you to make those symptoms worse. So the things that you would do to treat that type of problem are whatever's going to help the local problem if you have that going on as well. But you also want to focus on your posture, making sure that you've got your chin tucked like that, head over the shoulders, and not sitting out at your computer like that all day, where you're kinking the nerves in your neck. If you sit like that, it can also pinch the nerves where they come out underneath your collarbone here and go into the arm. Now there's a nerve called the radial nerve that runs right along the outside of the elbow, and a radial nerve dysfunction can actually have fairly similar symptoms as tennis elbow. Now, if you look up radial nerve glides, there's a little exercise where you kind of go like this or go like that, and those are all good things to do to get some, again, oxygen to the nerve, because nerves need a lot of oxygen and blood flow to be healthy, but largely fix the posture problem. So keeping your head in good position, getting arm support when you're sitting, and avoiding kind of rounding your shoulders out like that. So that was kind of a long-winded answer to the short question of what's the best tennis elbow stretch. But that's a thorough answer, and it's going to give you a lot better results than just do that as a carte blanche recommendation. So hopefully you found this video helpful, and if you did, give it a like or thumbs up, and subscribe to our channel so you can get notified of our other future videos. And if you do need some help for tennis elbow or any other type of elbow pain, then just get in touch with us at More for Life, and we'd be happy to help you out. Thanks for listening, and have a great day.